I think everybody knows that this is a very common problem. It is not only nasal congestion or nasal discharge, but it is also associated with allergies or asthma or eczema even in young children. It affects our life quality and it leads us very often to GP practices. It is important to know that approximately 30% of the GP referrals are relevant to ear, nose and throat conditions. Therefore, ENT, as you can imagine, is a very busy service. It has a pediatric aspect to it, it has an adult aspect to it, and throughout this, it has to be a seamless service in diagnosis and treatment. Regarding pediatric ear, nose and throat conditions, the most common cases that we will see early on in age below 3 years is obstructive sleep apnea, which is often underdiagnosed and at times undertreated. Disordered breathing, pauses in breathing causes parental anxiety correctly, as it has a huge impact in the child's development. Not only it presents with disordered breathing, but at the time many findings lead to a hearing deficit diagnosis as well. So this is a condition that needs to be looked at. So you should refer to your GP and ask for an ear, nose and throat referral. The common treatments for that is adenotonsillectomy, either intracapsular, that means shaving the tonsils, or extracapsular when we have also recurrent tonsillitis, removing part of the adenoid, and also putting grommets where we need to in order to drain the glue ear. These are one of the commonest conditions in children. Moving on to adults, I will not talk about the general ENT conditions, but the relevant ones to my subspecialty, the ones that are resulting in a blocked nose, that may be due to a bent cartilage in the nose that is called septal deviation, or coexisting fleshy congestion in the nasal airway that is due to inferior turbinate problem, possibly associated with underlying allergy, which is again sometimes undertreated. People have to have a good understanding that if there is underlying allergy that causes nasal congestion, that then leads to rhinosinusitis, which is very common, particularly in the winter months, and affects significantly the life quality. Thinking of all these conditions, one might consider that surgeries are difficult, they have maybe a huge impact in their life quality, and I want to reassure you that we take safe steps to provide a good journey through surgery. Most of the ENT conditions can be treated as day cases. Our activity is 99% day case procedures. So you are admitted in the morning, you have your surgery done, you have an observation period, and you can be discharged on the same day. You will have some downtime associated with some of the procedures, but not a significantly long downtime. More importantly, practicing now in the presence of COVID, is important to note that major efforts are made for the safety of the patients, with regular screening, of course, but regular screening of the staff of the hospital to make sure that a safety and high patients' care is provided.